OK, next tonight. Since 2003, the Movember movement has been raising awareness for men's health. This week, they've released a report which calls on ministers to focus on what they call the growing public men's health emergency. It found almost 2 in 5 men in the UK die prematurely, that's before the age of 75. And what's most striking is that it highlights in detail that where a man lives is strongly connected to how long he will live. And it's not good reading for Scotland. Here, the rate of premature male deaths is 26% higher than the rest of the UK. It found 5 of the 10 worst areas in all of the UK are in Glasgow. Glasgow North East has the worst rate, while its neighbour, just over in East Bartonshire, has the lowest. In a moment, we are going to hear from Rashik Saeed about his experiences of mental health. But first, to tell us more about this report, Tom Ellis from Movember is here with us. Tom, a very good evening to you and thank you so much for joining us. Tell us a bit more then about the report, the research, who you spoke to and what you found.
Yeah, so we launched a report today and I think it paints a very stark picture of men's health in the UK. So I think, as you mentioned in your intro, too many men across the UK are dying too young from largely preventable causes. And, 2 in 5 male deaths in the UK premature, it's about 133,000 lives a year gone too soon. And I think, as you mentioned, Scotland has the highest rate of premature mortality amongst men in the UK. And we polled, so it looked at sort of existing evidence, but also polled about 3,000 people across the UK about their experiences. And I think one of the really interesting things it shows is just its ripple effect that men's health has on wider society. We've all got fathers, sons, partners, brothers, mates who are affected by ill health, and it impacts all of us really strongly and has this direct impact on everybody. So I think what we're trying to do with this report is really called to note the fact that we need to act with urgency to tackle this crisis. And so Movember and 20 other partners involved in the report are asking the government to deliver a men's health plan that can prevent so many men from dying too young.
Well, tell us more about what kind of things then that you'd like to be addressed through that. What do you think the main problem is? Is there an issue with communication with men going to the doctor and asking for help?
Yes. I mean, it's a complicated picture, I think, as it shows in the report. But, there's a number of different reasons why men are dying too young. I think they're more likely to have less healthy lifestyles, engage in risky behaviours. In general, they're less likely to seek help when they need it. I think men are not always being proactive about their health. In the UK, if you're aged 40 to 75, you're eligible for an NHS health check every 5 years. The latest data shows only 62% of men actually, complete that health check. And I think another contributing factor, which again has really been showcased in the report, is that healthcare isn't always responsive to the needs of men. So when men do seek help, in our report, it showed that 63% of men reported wanting to leave the kind of healthcare practitioner they were with due to a lack of personal connection. So I think it's also really important that we're looking at the healthcare system and how it's responding to gender and responding to the needs of men. So I think what we're kind of asking for when we ask for this sort of strategy, we're looking at 3 areas. So one is strengthening health literacy among men. So initiatives reaching men and giving them the right knowledge and skills so they can better understand their health. We want to transform the health system and workforce by making it gender responsive, as I mentioned, so fewer men are dropping out when they do go and seek help. And we also want to see an investment in research into men's health specifically.
OK, and in terms of policy, Movember has been speaking to Neil Gray, the Scottish Health Secretary, about policy change around this. What do you think the Scottish Government should be doing immediately to, quickly to try to address these figures?
Yeah, we've been speaking to Neil Gray. He's actually visited one of our programmes as well, Changing Rooms in Scotland, which we run with Scottish Action for Mental Health. So there's a really positive noises coming out. I think we also shared the report this morning with about 200 policymakers, and Sir Gregor Smith, the Scottish Chief Medical Officer, was one of the first people to respond. So I think we're hopeful of a great collaboration to create change. But what we'd love to see is an announcement of a plan for men's health, a national plan for men's health.
OK, well, thank you so much for your time tonight. Many thanks. We're really grateful to you. And joining us now